To introduce our first speaker, Dr. Barbara Pockaj. Dr. Pockaj is on staff here at Mayo Clinic in Arizona. She's a consultant in general surgery. She is the Michael M. Eisenberg named professor of surgery, which is a very big deal, and certainly the first surgeon in Arizona to spend her career here and be named with that honor. She will speak with us today about nipple abnormalities. Please join me in welcoming Dr. Pockaj.
A little shorter. Thanks for coming this morning, waking up nice and early. And I have no disclosures. My only disclosure is if you don't like a topic, don't write about it, because then you have to be asked to talk about it a lot. So what we'll talk about today is different nipple symptoms, management of nipple discharge, infections involving the nipple-areolar complex, and discuss benign and malignant tumors of the nipple. So I'll try to give you a nice overview. What about nipple retraction and inversion? People worry about this. It's not uncommon someone comes in and says, well, my nipple's inverted. It never used to be before. And there are distinct definitions which actually imply one thing or another. I don't think you have to remember which one is which per se, but which one may be more worrisome than the other one. So if we define something, nipple retraction occurs when only a part of the nipple is retracted during tethering. So you see only a part. Nipple inversion occurs when the entire nipple is pulled in. And the ramifications for both of those are different. Nipple retraction is due to benign causes. It's spontaneous, can happen in adolescence, and some people will tell you they've had this nipple inverted forever, and that's not uncommon. You could get ductictasia. Another term for this is periductal mastitis. This is the most common, and these are fat ducts, was what I tell people. Go, what is ductictasia? And I just say fat ducts. It has nothing good or bad. It's just one of those benign conditions that can happen in women. There's Mondor's disease, which is a superficial thrombophlebitis of a vein, and sometimes you see this. Some patients can get this from some trauma on the breast. Most commonly, I see it as post-surgical. You can get some fat necrosis, which causes then some pulling down or some scarring from the cause of that. Again, that's secondary to some sort of trauma to the breast. And probably the most common is post-surgical changes. I did ask my resident